get up for school. Fern, sweetheart, it's time to get ready for school. Fern, get up now.
Mom, I don't feel very good.
You don't look good. You're burning up. I'm going to get a thermometer. Fern, stick this under your tongue. $104.
Am I going to be okay?
I'm sure it's just a cold or the flu or something, but I'm going to call the doctor.
Okay.
Get some rest.
This is Dr. Templeton's office. How may I assist you?
Hi, I'm calling regarding my daughter. She's a fever 104, and when I was talking to her, she seemed to be panting a little bit. I'm really concerned.
Oh, wow, that is really high. How old is she?
She's 12.
Okay, you should probably take her to the emergency room as soon as you're able to.
Okay, I will. Thank you very much.
Of course, make sure you are ready to discuss all of Fern's symptoms she has been having so the doctor can quickly and properly diagnose her.
Okay, thank you. Fern, the doctor said it's going to be a while, so just have a seat on the couch. I can read you a book.
Fern, Dr. Wilbur is ready to see you now. You can come on back.
Come on, sweetheart.
Well, Miss Fern, what seems to be troubling you today?
Well, this morning I woke up and I felt awful. I had a high fever and I was sweating a lot, and I can't seem to catch my breath.
I see. Anything else?
Well, yesterday I was having a little bit of trouble when I was talking. My mouth felt kind of stiff, and it was kind of hard to swallow. And also, I kind of have been drooling a little bit.
Is that all you can think of?
Actually, on the way here, my face muscles were kind of twitching. Like, they were moving, but I couldn't control it. I don't know.
Is this the first time you've experienced this?
Yeah, I think so. Oh, and yeah, my shoulder muscles have been pretty sore too.
Okay, Fern, I'm going to have you go back to the other room with Nurse Charlotte while I talk to your mom for a minute. She's going to do some tests and a physical exam to try to find what's wrong. Is that okay with you? Let's go.
Here are Fern's test results.
Thank you, Nurse Charlotte.
Is she going to be okay?
I'm not sure yet. Based on these Bell's palsy tests which we administered because of her face twitch, came back negative, and she doesn't seem to have any flu or respiratory infections. I'm going to have to ask you a few questions. Does she have any deep cuts or anything in the last couple weeks?
Oh yes, I completely forgot to mention. Fern, I think last week, was playing with her friends and her siblings outside, and we have a chicken coop, and a couple nails come loose for a minute, but it's really not a big deal. And she stepped on one, so I wrapped up her foot, and everything was fine. She complained it was sore for a few days, but I just didn't pay attention to it.
Did you make sure to clean the cut?
Yeah, I cleaned it with hydrogen peroxide, and I wrapped it up in ace bandage.
This cut may be more serious than we think. She may have contracted tetanus. She is showing all the symptoms for it, and the fact that she has very recently had an accident like this only helps prove this further. Has she received her tetanus vaccination?
I think she did when she was born, but I don't think since
Nothing
then.
in the last 5 or 10 years?
Not that I can recall.
Well, Mrs. Webb, I'm sorry to say this, but after all the symptoms that Fern is showing, I believe she has tetanus.
Tetanus?
General tetanus, yes.
Is there any more tests you can run? Are you sure it's tetanus?
I'm so sorry, but I believe it is. Tetanus is a disease which enters the body through a deep wound or a puncture. From there, the bacteria impairs the motor neurons. In other words, the bacteria gets into your body and inhibits the nerves from properly communicating with the muscles. As of right now, tetanus is an uncurable disease.
Is she gonna be okay?
About 25 to 50% of people who do contract tetanus do pass away prematurely. However, the fact that Fern did not begin showing serious symptoms until almost a week later, and the fact that she is old enough to have a very strong immune system, greatly increases her chance of survival.
But will she live with this for the rest of her life, for however long that may be? What does this mean?
Well, for Fern, we will have to give her a tetanus booster shot, which will hopefully eliminate most of the toxin that has yet to bind with the nerve cells. Also, because there are extreme spasms that come with tetanus, Fern will have to take sedatives in order to mask these painful spasms. Because there's no cure, Fern will be on medications aimed at easing the pain for the rest of her life.
Can you just please bring Fern in here?
Of course.